Hi, welcome back to the Breeze Medicare channel. We are glad to have you today. Today we are going to talk about shoulder joints and shoulder complex. Many people come to the physiotherapy clinic or orthopedic clinic with shoulder pain. There are a lot of pathologies that can lead to shoulder pain. For you to know which pathology that is causing your shoulder pain and how best to treat it, you need to understand the anatomy and structure of the shoulder joint. Knowledge of a shoulder joint will help you to manage your shoulder pain or other shoulder pathology effectively. In my hand here is a model of shoulder joint. This is not a real human skeleton. A lot of literature affirms that the shoulder is a complex joint made up of four joints. Four joints make up the shoulder complex. I'm going to list them with this model and this model of human skeleton. The first joint in the shoulder is glenohumeral joint. As the name implies, it is a ball and socket joint between the ball-shaped end of the humerus. Humerus is the arm bone, and the glenoid cavity or glenoid fossa of the scapula, as you can see in this picture, is a joint between the head, ball-shaped head of the humerus, and the glenoid fossa or glenoid cavity of the scapula. Is a synovial joint. Second joint that make up the shoulder complex is the acromioclavicular joint. As the name implies, is a joint between the acromion of the scapula and the lateral end of the clavicle. The clavicle is the collarbone, and the scapula is the bone you find at the back of the shoulder. The third joint that make up the shoulder complex could be demonstrated with this model. It is called sternoclavicular joint, a joint between the medial end of the clavicle. This is the clavicle, collarbone, the bone you find here, and the sternum. Sternum is one of the bones of the axial skeleton, the bone you find here. Then, the third joint that make up the shoulder complex is an articulation between the scapula and the thoracic cage. It is called scapulothoracic articulation, not actually a raised joint. These are the four joints that make up the shoulder complex. For the purpose of this video, we are going to focus on glenohumeral joint, the joint between the ball-shaped end of the humerus and the glenoid cavity or glenoid fossa of the scapula. It is a ball and socket joint. It is a synovial joint. There are some cardinal features every synovial joint has, or most of the synovial joints are known for. Number one feature is presence of a synovial cavity or joint cavity. Joint cavity is the space between the two bones that make up the joint. Between the ball-shaped end of the humerus and the glenoid cavity of the scapula, there is an intra-articular space. This space is called synovial cavity. Another feature of a synovial joint is presence of synovial membrane. Synovial membrane is a thin layer of membrane that covers the joint. You may not see it here because this is a model. This synovial membrane produces a synovial fluid. The synovial fluid helps to lubricate the joint. Without the synovial fluid, we may find it difficult to move our shoulder. But with the presence of synovial fluid, we can easily move our shoulder without much friction. The third characteristics or feature of a synovial joint is that they are stabilized by ligaments. In the case of the shoulder, there are about four ligaments that stabilize the shoulder joint. Number one is the coracohumeral ligament. As the name implied, from the coracoid process of the scapula to the humerus. It originates from the coracoid process of the scapula and attaches to the humerus. You may not see it here because this is not a true joint. This is the model. Number two is the coracoacromial ligament. It originates from the coracoid process and attaches to the acromion of the scapula. This is the ligament, coracoacromial ligament. Number three is the glenohumeral ligament. As the name implies, it originates from the glenoid cavity of the scapula and attaches at the head of the humerus, glenohumeral ligament. The fourth ligament is the transverse humeral ligament. These four ligaments stabilize the shoulder joint. Also, another thing that contributes to shoulder stability is the presence of four muscles called rotator cuff muscles. These rotator cuff muscles, in addition to stabilizing the shoulder joint, also contribute to shoulder mobility. They are supraspinatus muscle. The supraspinatus muscle originates from the suprascapular fossa and attaches at the greater tubercle of the humerus. It helps in abduction of shoulder. Abduction is just moving the shoulder away. It initiates the abduction up to 15 degrees before the deltoid muscle takes over. The second muscle is infraspinatus muscle. Another muscle is teres minor. The fourth muscle is the subscapularis muscle. Subscapulary muscle helps in the internal rotation of the shoulder. These are the muscles that contribute to stability of the shoulder joint. Another feature of a synovial joint is the presence of a bursa. Bursa is a fluid-filled sac. Bursa is a fluid-filled sac that helps to reduce friction where the muscle passes through a joint or where the muscle passes through a bony surface. There are about four bursae in the shoulder joint. There are subdeltoid bursa, subacromial bursa, subscapular bursa, and subcoracoid bursa. This bursa helps to prevent friction or reduce friction between the tendons that transverses through the shoulder joint when shoulder goes into motion. There are about 6 or 8, there are many motions, shoulder movement. The shoulder is a ball and socket joint. It is the most mobile joint in the body. There are about 6 motions in the shoulder. There is flexion, just moving your hand forward, extension, moving your hand backward, abduction, moving your hand away from your body, adduction, returning it, external rotation, internal rotation. There is also another motion called horizontal abduction, horizontal adduction, and finally circumduction. These are movements obtainable in a shoulder. The shoulder is the most mobile joint in the body, and because it is the most mobile joint in the body, it is also prone to injury. One of the factors that makes shoulder to be prone to injury or makes it the most dislocated joint in the body is the fact that the humeral end, the ball-shaped humeral end, is bigger than the glenoid fossa. In anatomy, only about 1/3 of the head of the humerus fits into the glenoid fossa of the scapula. This makes shoulder vulnerable to dislocation. Another feature of a synovial joint is presence of fibrocartilage. Fibrocartilage also contributes to shoulder stability. In the case of shoulder, the fibrocartilage here is labrum. Labrum contributes to shoulder stability. However, this is also subjected to injury, which can lead to shoulder pain. Another feature of a synovial joint which shoulder has is that they are well vascularized and they have nerve supply. In anatomy, when you say that a joint is well vascularized, it simply means it has enough blood supply. In the case of the shoulder, the axillary artery supplies blood to the shoulder. The shoulder gets its nerve supply from the axillary nerve, subscapular nerve, and lateral pectoral nerve. Because shoulder is the most mobile joint in the body, it is prone to a lot of injuries. These are some of the injuries or pathology that can affect the shoulder. Number one common pathology that can affect the shoulder is shoulder dislocation. As I said, because of discrepancy between the head of the humerus and the glenoid fossa, the shoulder is prone to dislocation. A lot of people at one point in their life has had shoulder dislocation. It is very common in our society. Number two pathology that can affect the shoulder is fracture. There could be fracture of any of the bones that make up the shoulder complex or the shoulder joint. This is called intra-articular fracture. When the fracture occurs within this joint surface, any of this bone breaking, is called fracture. Don't forget that a fracture occurs when a bone breaks. Then another pathology that can affect the shoulder is shoulder osteoarthritis or shoulder arthritis. And when you talk about arthritis occurs in many forms. It could be shoulder osteoarthritis, it could be rheumatoid arthritis, it could be reactive arthritis, it could be infective arthritis, it could be gonococcal arthritis. There are many forms of arthritis. Another pathology that can affect the shoulder is a frozen shoulder. Frozen shoulder is very common in our society. It occurs when there is thickening and scarring or scarification of the shoulder capsule. It leads to reduced range of motion, joint stiffness, pain, and reduced functional ability. In most cases, it resolves on its own. However, physical therapy can help to facilitate the recovery or to improve the shoulder range of motion while the recovery takes place. Another pathology that could affect the shoulder is tendinitis, because there are a lot of muscles that passes through the shoulder. Any inflammation of the tendons that attaches to the shoulder or passes through the shoulder leads to shoulder pain. There could be rotator cuff tendinitis when the tendon of the rotator cuff muscles are inflamed, or there could be bicipital tendinitis when the tendon of the long head of the biceps, which passes through the shoulder, is inflamed. Another pathology that can affect the shoulder is rotator cuff tear. If there is tear or injury to the rotator cuff muscle, it can lead to shoulder pain. Then, injury or arthritis at the neck called cervical spondylosis or cervical radiculopathy or cervical pathology can refer pain to the shoulder. Thoracic outlet syndrome is another pathology that can refer pain to the shoulder. There are other inflammatory conditions such as erythromyalgia, polymyalgia rheumatica, fibromyalgia that can result to shoulder pain. However, in physical therapy, we have a lot of physical examination to differentiate all these shoulder pathology. How to take care of your shoulder joint? Because the shoulder is very important for our daily living, because the shoulder is very important for us to maintain our daily activity, you need to take care of your shoulder. First, by exercising your shoulder. Second, by eating balanced diet. Third, by not overstressing your shoulder. If you must start any new activity such as gymming, you must progress your activities. 4, by avoiding substance abuse. Many research has linked shoulder pathology to substance abuse, such as excess intake of alcohol or taking of hard drugs. Also, heavy smoking has been linked to many shoulder pathology. Finally, if you have any shoulder pain, if you have any shoulder injury or pain, try to consult a specialist, consult a physical therapist or your doctor for appropriate diagnosis and treatment of your shoulder pathology. Don't forget to leave a comment in this video if you have any shoulder pathology. We could help to give you an advice on what to do to relieve your shoulder pathology. Note that this video is for educational purposes alone. Don't use this video as an alternative way of going to the hospital. Do check my channel. I made a separate video on some common causes of shoulder pain or common shoulder pathology. I also made a separate video on some of the exercises you can do at home to relieve shoulder pain, shoulder stiffness, and to improve your shoulder range of motion. Please, if you are new to this channel, kindly subscribe to our channel, hit the notification button, and also give this video a thumb up. By hitting the notification button, you will be notified whenever we release any of our amazing videos. We are glad to have you today. Thank you for coming to our channel. We look forward to seeing you again. Bye.